Statistics show that morbid obesity affects over 70 million people in the United States. Their life expectancy is reduced by as much as 20 years in men and by about 5 years in women. They often suffer from low self-esteem because of their weight, and it's usually compounded by other health issues such as type 2 diabetes, high blood pressure, heart disease, sleep apnea, strokes, depression, and overall poor quality of life. One of the quickest and safest ways to overcome morbid obesity is getting the gastric sleeve surgery. Let's meet one of the nation's leading surgeons for the gastric sleeve surgery, Dr. Ronald Moore, and hear how he's helped thousands of people get back to being healthy again.
In terms of surgical weight loss, I think what sets us apart, what sets me apart, is not just the fact that I've been doing it more than 20 years. So I have the experience and the full evolution of what we used to do and why we actually do what we're doing from a surgical standpoint at present. But I think it's the understanding and the personal touch that is not just doing a surgery on a patient and sending them on their way, but really committing to the success of the patient in their journey of surgical weight loss.
My previous weight prior to surgery was 396. I went all the way down to 228 and now roughly in the 230s, maintained for 3 years now.
Dr. Moore is a gifted surgeon. I've worked with him for over 11 years. And he's not only a general surgeon, but he's a trauma surgeon. So when he's doing surgery on you, he has that much more education, knowledge, and he's just a gifted doctor.
My journey with Dr. Moore started at a very young age, actually. I was 16 when I first got bariatric surgery with Dr. Moore. And I didn't really think that my eating habits could affect me. I mean, I was only 16, I didn't know any better. But then I started having a lot of health concerns, you know, my blood pressure, I was pre-diabetic, my knees were hurting, my back was hurting. And that's when I came to the decision and said, I need more than just a diet, I need more than just to see a nutritionist, I need help. Since the surgery, I've lost approximately 180 pounds. And I'm currently 176 pounds, and I was weighing 320 when I first started, so yeah, around 180 pounds.
If I were to tell somebody about the process, I would let them know that as far as our practice, we've streamlined it. We know what the struggles are as far as the patient committing to go forward with having surgery. So we're here to answer those questions. The one question that I get for some patients is, do patients regret it? And I try to communicate a sense of urgency, because the one thing that I've consistently heard from my patients is that they wish they had done it sooner.
Aren't you worth it? Aren't you absolutely worth making that change? Getting healthy, moving, being with your children, getting off that medication that could cause you more damage down in the long run. Why not? Do it.
Dr. Moore, I can tell him anything because he's like a brother, but mainly, you know, thank you. And I don't think I'm the only one who thanks him. I think my family as well thanks him. You know, they see me now that I'm more healthy, more active, up and down more. You know, he's given me back not only, you know, things of looks or this or that when it comes back to, you know, normal thing, but he's given me a better quality of life. And that in the end is something you can give to someone that there's no price on it.